Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First, under the AHA BLS guidelines, anyone from age 1 year old to puberty is considered a child. Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls. When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's approximately 2 inches or 5 centimeters. And the chest must recoil completely between compressions. Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, if you're a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
It's important to note that giving breaths to children requires less volume and force than giving breaths to adults. Breaths that are too large or forceful have greater potential to cause lung trauma in children than in adults. However, you still need to provide enough air to see the chest rise.
Another difference is when to activate the emergency response system. If you do not witness the arrest and you're alone, you should perform 5 cycles of CPR to deliver oxygenated blood to the victim's brain before you activate the emergency response system. If the child has an adequate pulse but is not breathing normally, it may be due to a respiratory problem, so you must provide rescue breaths. Deliver 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute.
If you are alone and witness a sudden arrest, leave the child so that you can activate the emergency response system and get the AED. Then return to the child to perform CPR and use the AED.
Now, let's combine the BLS skills that you've learned for adults with the differences we just reviewed to practice BLS for children. For this session, we'll practice 2 rescuer child CPR by using a 15 to 2 compression to ventilation ratio. One person will provide compressions while the other delivers breaths with a bag mask device. We'll pause here while everyone gets into position.